Joining us now is Dr. Ernst von Schwarz, a medical researcher and cardiologist based in the LA area. Thank you so much for giving us your time. We know you could not have a lot of it to give with so much going on in California. Thanks for being here.
Thanks for having me on, Yetta.
Okay, so we in Arizona, we just had about, again, you probably just heard that, a little over 5,600 new cases. We had 191 new deaths. Can you give us an idea of how different the numbers are in California just today?
Well, I don't have the exact numbers with me right now, but I can tell you from my experience being in 6 hospitals on a daily basis, from large academic centers to smaller community hospitals, it is an absolute nightmare right now. Yeah. So, for example, I'm sitting right now in a hospital with 400 beds, and almost 100 of the 400 patients in the hospital right now are COVID positive. The intensive care unit has 50% of their beds occupied by patients with COVID-19 on a ventilator. I mean, that was unheard of, and we haven't seen that even in March or April.
Doctor, can you help explain this to us? Because we're now in phase 1B here in the vaccination process, so a lot of people are getting appointments, hundreds of thousands of people now expected to get the vaccine. Can you explain to us this answer? Because I'm getting a ton of emails from our viewers who are like, wait a second, you mean if I get the vaccine, I get the booster shot, I still have to wear a mask? Explain how you can still be a carrier of this virus, even though your body has built up all of those antibodies to protect you.
Absolutely. I'm glad you asked that question, Brenton. So the vaccine creates an antibody response. We build antibodies. We build what we call T killer cells and other cells to fight the virus, fight the disease. But the vaccine does not prevent from us getting the virus. So even though we might be immune from the disease, and the studies have shown basically that disease, in particular severe disease, has been reduced in 95% of cases for the 2 vaccines which are available right now, we still can get the virus. That means we will be contagious. The issue is with the vaccine then, if we have an appropriate immune response, we might not have any symptoms, not even fever. So if I go into a hospital, for example, the first thing what they do right now, they check my temperature. So once you have the appropriate immune response, you might not even have temperature or any symptoms, but you still can have the vaccine, and you can transmit you still can have the virus, and you can transmit the virus to others, and in particular those at higher risk, and they, if they are not vaccinated, can get severe disease. So for that reason, it's absolutely a must to keep the distance measures intact, to wear the masks, to avoid gatherings, to use appropriate hand washing, sanitizing measures as recommended from the get-go.
Yeah, that is so interesting what you just explained about having the vaccine, because I think in one of the stories we had just a minute ago, we talked about how and when people getting the vaccine will have the numbers change. When will it affect the numbers, and we can start seeing a downslide in the numbers? Maybe not necessarily for a very long time, based on what you just said.
Well, I mean, many health officials, including Dr. Fauci, said weeks ago we need to have 70 to 80% of the population vaccinated in order to get rid of the pandemic. So that's a very high number, and that will take a long time. I mean, here in California, as well as in Arizona and your place right now, we're doing the vaccinations for healthcare workers and senior citizens in nursing homes. And in the next year, of course, we will distribute the vaccines to other essential workers and those at higher risk. But it will take several months. What we are seeing right now in the hospitals is probably still the surge from gatherings during the holidays, in particular Christmas and New Year's, and we do expect actually a further surge within the next 1 or 2 weeks. But hopefully over the next 3-4 months, we will see a decline in numbers. I can tell you that from my own experience, I'm a cardiologist, so I deal with very sick patients, especially those who need a heart transplant. But I have never in my entire career had to sign so many death certificates as I did in the last 2 weeks. Every day on average, at least 1 to 2. So people die of this disease every single day. There's some data in California, every 8 minutes, someone is dying of coronavirus.
Wow. It gave me goosebumps when you just said that. So now I have to ask you, how are you even taking care of yourself while taking care of so many people who are sick every day?
Well, it's very difficult, but we as healthcare providers, of course, we promote the distance measures. When I go into a room of a patient with COVID, of course, I have to change. I have to wear the gear. I have to wear the shield. I have to wear the N95 mask, and so on. And everybody does it. In addition, I just got my second vaccine shot yesterday, so
I really meant mentally. How are you taking care of yourself mentally? Because this is a lot to deal with on a day-to-day basis.
It is, and it's unprecedented for all of us. We have never basically encountered such a situation. It's difficult. I mean, my outlet is to exercise if I have the time, either very early in the morning or late at night, to release the stress. But it's hard, and I see the nurses really at the edge of their capacity, mentally as well as physically, every single day, and the doctors too.
Dr. Ernst von Schwarz, thank you so much for your time, and we appreciate everything you're doing. We know you're going through a lot. We appreciate your time tonight.
Thank you so much for having me on. Good luck to you guys.
All right, coming up.